I'm Dr. Varun. Good evening, everyone. And we are here at in RV, Aster RV Live. We are here to talk about knee health. And Dr. V Srinivas, sir, lead orthopedic consultant, will be actually briefing about all the knee health one should actually take care of. So please.
Yeah, good evening. So we are here discussing about the knee health basically in young population and elderly population. In young population, we do nowadays seeing a lot of patients coming with knee pain. When we get the x-rays, we see that the x-rays are completely normal, but these patients are getting knee pain. The reason what we see in this is two. One is mechanical reason, other one is metabolic, what we call. Metabolic is some of the patients or some of the youngsters are trying to lose weight, and what they're doing is trying to take more of protein and reduce the carbohydrate. What's happening? They're not taking a balanced diet. They're moving towards a protein diet to reduce their weight. So this is leading to increase in the uric acid production. Basically, uric acid is a waste product of the proteins. So when you take lots of proteins, the body is not able to eliminate the uric acid which is produced in the body. Normally, the uric acid produced is eliminated through kidneys when it passes out in the urine. When it accumulates more than the kidney can eliminate from your body, what we call it as gout or hyperuricemia. So in this condition, patients do experience a lot of knee pain. That is a metabolic condition. Apart from that, young ladies may be suffering with hypothyroidism. The early symptoms of hypothyroidism is knee pain and menstrual irregularities in a young woman. These are the two common metabolic problems what we see nowadays, patients suffering with knee pain. The third is mechanical, which I said. Usually patients, suddenly they have a bout that they want to lose weight, they start doing exercises, they go into fitness mode and they start running, jumping and doing a lot of physical activity aggressively.
Correct.
People should remember the exercise program should be gradually increasing. That three things are important: the intensity of exercise, duration of exercise, and the intensity. Intensity, duration, and the frequency. The three things. Third is frequency. As to gradually increase, you cannot start an exercise program that every day I'll do for 1 hour, every day you continue that, and after 10 to 15 days you land up in the hospital having severe bone pain and knee pain. This is very common. What we call January 1st syndrome. People take on January 1st they decide that they have to lose weight. That's a resolution for them, New Year resolution, that they have to lose weight and start off with a health club, and they go take 6 months membership, 1 year membership, and then they start doing exercise. Within a month they are in the hospital with severe knee pain. So the bones are not used for such an exercise program. You need to tune it. If it's not used, patients do develop what we call bone edema or contusion, where patient develop a lot of knee pain. So the ideal way is gradually increase your frequency. That is, if you're starting, start with exercise once in 2 days, and then gradually once in a day, once in alternate days, and then every day. And again, the duration, you should start with 10 to 15 minutes of exercise, gradually increase the duration, maybe 20 minutes, 30 minutes and 40 minutes, and then reach 1 hour. Don't straight away start doing 1 hour exercise which your bones are not used for. And then the intensities. I have seen many people straight away, they go on a treadmill running at a speed of 6.5, they start off and they reach their 9, 10, sometimes some people 15, 16 they are running, which they are not used to it.
Yes.
See, if you're used to it, it's a different story. For a people who are starting exercise program, should be at 4.5 to 5. It may be looking very crazy, walking very slowly, but the bones have to adjust for it.
Correct, sir.
So from 5 you start and gradually go to 6 and then progress to 7. If you are a youngster who want to just maintain, you don't want to have a fitness freak or something, then 6 is very good. 6 and 6.5, a maximum of 7 is very good. Doing 20 minutes and then moving on to different cardio exercise. It can be cycling, it can be cross trainer, elliptical, treadmill. Everything 15 to 20 minutes you do at a speed of 7 to 7.5, you will be fairly good enough, no bone pains. If you cross these limits, definitely you come back with knee pain. Yeah, this is what happens in youngsters developing knee pain. Now coming to elders who are more than 50 years. So they do develop knee pain. This is gradual wear and tear of the knee joint which is happening as a natural aging process. It can happen to anybody. If the person is very active at younger age group and is doing regular exercise, these patients experience less pain. But elderly patients who are not very active, whose life is very sedentary lifestyle, especially our Indian woman who is restricted to the household activity and not very much doing very much exercise, not taking care of the body weight, these patients develop a knee pain which is approximately 50 to 55 years. Initially what they have is getting up from a sitting posture, climbing stairs, getting downstairs, sitting on the floor and getting up, and sometimes they do develop night pain. These are the early symptoms, and then gradually the pain will start increasing. This is a classical history of patients suffering with osteoarthritis. And this over a period of time, these symptoms will increase. It is going to hamper the quality of life. Any patient or any person starting with this kind of knee pain, then they should be very cautious. First thing, they have to reduce their body weight. If they reduce their body weight by at least 5 to 7 kgs, 90% of the knee pain symptoms is gone. First thing. Second, if they are a diabetic, hypothyroid, high uric acid levels if they are having in a normal thing, or any metabolic high cholesterol level, they need to control it. Any patient suffering with these metabolic problems, they experience more knee pain than what we see on the X-ray. What we see on a normal population, when you compare to them, these patients do develop early knee pain and the symptoms are very heavy. So especially hypothyroid and diabetic patients, they have to control this. Then they need to have an exercise program. Every day, every person, any human being need to have an exercise of 15 to 20 minutes. They need to spend on themselves on exercise 15 minutes, or what we say 4 hours a week.
4 hours a week.
4 hours. You can split it according to your convenience. If somebody is working or they have only weekend is off,
correct,
then they can do Saturday and Sunday 1 hour of exercise. That keeps the whole week for them, maintains the fitness. Yeah, that is enough for them. Or if somebody has no time in the weekend, then they can spend 15 to 20 minutes or half an hour every day. That gives a phenomenally good health for them, correct, especially related to the knee and bones. That is the exercise program. Then there are people, they may require medication. Straight away don't go to a pharmacy and buy heavy painkillers.
Correct.
Initially start with paracetamol tablets. Maximum you can go up to 3 tablets a day for 4 to 5 days till the pain comes down, and then stop it. Paracetamol is the safest medication for any person who can take for knee pain. Okay. Then there are certain nutritional supplements I'm sure most of the people get from their children who are staying from abroad. The most common gift what the elderly patient or a person gets from a children who stays abroad is a calcium tablets.
Correct.
It's the most common gift. It's not gold, dollars, nothing. It's a calcium tablets and some glucosamine.
Correct, sir.
Calcium and glucosamine tablets are good. Calcium tablets, you require 500 milligrams of elementary calcium per day. On a regular basis, you can take up to 6 to 8 months. With that, you need to combine vitamin C tablets, which helps to increase the nutrition of the bones. So, vitamin C 500 mg you require, or naturally you can increase the vitamin C by taking lime water juice every day, orange, musambi juices. These are natural methods. With vitamin C, you need to sometime add vitamin D3. If they are deficient in vitamin D3, you need to have vitamin D3 sachet. Every week once, on early morning, you need to take on an empty stomach. After half an hour, you can take your normal food. But vitamin D3 can be mixed with water, juice, milk, whatever you want. You can mix it. Comes in liquid form. It comes in a powder form. You can mix it and take it. That helps to build up your bone quality.
Correct.
The glucosamine tablets you get, and many people don't know what is the dosage they need to take. Glucosamine, it comes in 750 milligram tablets and 1.5 grams.
1.5 grams.
On an average, per day you need to take 1.5 grams per day. Either in single dose or divided dose. You need to take 1.5 gram per day and take it continuously for 6 to 8 weeks. You cannot take for 2 days or 3 weeks and expect it to have miracle. It will not happen. So they need to take for 8 weeks, see how the symptoms are improving. If the symptoms are improving, that means the pain is reduced, they're able to climb stairs, they're able to do the daily activities, then that patient is responding to glucosamine. They can continue the same glucosamine once daily dose for at least 6 months. At the end of 6 months, they get a maximum benefit. After 6 months, any person taking glucosamine is not of much use, it's just a nutritional supplement.
Supplements.
Yes, these are things. In case any patient or any person is not relieved with paracetamol, calcium, all these methods which I told, with exercise, weight reduction, everything is not getting relieved, then they have to meet an orthopedic doctor. What I say is 99% of patients who are suffering with knee pain can handle with whatever method I said, like nutritional diet control, weight reduction, regular exercise, calcium supplementation, glucosamine supplementation. These methods can help most of the patients control the knee symptoms. Only 1 to 2% of the patients require orthopedic doctor consultation. Even in the 2%, if patients suffering with who fall in this 2% group, when we see them, most of them can be managed with some kind of injections into the knee, what we call lubricant nowadays. We can give that, we can give some dose of painkillers or short course and put them on a physiotherapy program. Most of them solve.
Yes.
Even every 10 patients what I see, only one patient requires surgery.
Yes, okay.
Just imagine. So 98 to 99% of people can manage the knee pain without surgery. Only 1% patient requires surgery. And in case if somebody is requiring surgery, not to hesitate. Because we suggest surgery in the last stage of osteoarthritis.
Okay.
When you have exhausted all the methods like medication, physiotherapy, nutritional diet control, and you have taken medication, you have done physiotherapy and all modalities you have done, if you are not getting relief, when your quality of life is affected, you are not able to move from one room to another room, you are not able to walk, you are not able to get up from a sitting posture, not able to climb stairs, get down stairs, you require somebody help or a cane to walk, then you have severe pain in the night. That is an indication for knee replacement. Knee replacement is one of the most successful, most predictive and most pain relieving procedure in the history of medicine.
Best prognosis.
Yes, it has a best prognosis. If the surgery is done in a very good center and with the help of a good anesthetist and a good surgical team, the result is almost 99 to 100% success.
Brilliant, sir.
Yes. But to save cost, if you go to a smaller center where they don't have adequate infrastructure and support system, because knee replacement is usually done for elderly patients who are 60 years plus.
Above, yeah.
So all these patients do have metabolic problems like diabetes, thyroid, cardiac related issues, many other issues they have. So if these patients, if they are undergoing surgery, better to choose a hospital which has all the infrastructure, cardiology, intensive care, physician, good surgical team, anesthetist, ICU infrastructure, everything should be good so that your results are good.
Correct.
You try to save few thousands and land up in a complication. That is what. Of late, what happened, because the government of India policy, the implant prices also come down. There were times when we used to get implants starting from 60,000 to 2.5 lakhs. Today, the government has done a ceiling that all implants has to be sold between 55 to 70 to 78,000. That's a government fixed price. Whether you go to any hospital in this country, the price is the same. So patients can utilize the facility what the government has given, the benefits what they have passed. Definitely there is a benefit. The day when it was 2 lakhs, some ceramic implants, today it is 88,000. So patients can take benefit of it, and the quality of implant has improved so much. Nowadays I hardly do cobalt chrome, that is stainless steel implant. We are using ceramic implants, the life of it at least 25 to 30 years. So youngsters who are suffering with knee arthritis, especially who are in between the age of 55 to 60, they can comfortably undergo knee replacement and have rest of their life, that is 25 to 30 years, comfortable, painless knee. They can, their knees which are bent because of arthritis will be straight. They can walk as much as possible. They can climb stairs as much as possible. They can drive two-wheelers, four-wheeler, auto, bus, lorry, aeroplane, car, whichever they want to drive, they can drive. They can go for a wedding, mall, picture, movie, whatever. They can enjoy their life.
Correct.
They get back the second life. That is what we call second innings. So knee replacement is, as I said, one of the most successful, most predictive and most pain relieving procedure in the history of medicine. Okay.
Yes, sir. And this complete information about knee pain and knee health was very useful, and I hope even viewers actually got all the information what they need, especially youngsters and for the people who are 60 plus. And now we'll go for viewers' questions which are coming from live. There's a person called Arjun has a question. What are the signs of knee pain? Initial signs of knee pain.
Initial signs of knee pain is getting up from a sitting posture. If you are developing some arthritis, getting up from a sitting posture is the first thing they have. And what we call, this is called rest pain. Somebody takes rest in half an hour, sits in a chair for some time and gets up. The first few steps are painful. That is what classical osteoarthritis. Classical sign. Or somebody gets up in the early morning. They had a nice good night's sleep of 6 to 7 hours, gets up, and first few steps are painful. As they walk, after 10 to 15 minutes the pain wears off. This is a classical that they are developing osteoarthritis.
Correct.
But this pain is different from what patients suffer because of metabolic condition or because of injury or something. We cannot correlate everything together, but
Correct,
what
sir.
I said is classical osteoarthritis.
Fine, sir. Okay. And the next person, Nikhil Verma, he wants to know which is the best vitamin to which helps in knee health.
So there is
Supports.
nothing best vitamin. What I suggest is every person should have a balanced diet.
Correct.
Diet is very important. Most of the micronutrients you get from diet. Second, you need, if somebody requires calcium supplementation, usually it required after 50 years only.
50 plus.
Nobody should take less than, somebody who is less than 50 years should not take calcium supplement as if it is a very essential element. No, the diet itself is enough. The bones are strong enough. You don't require calcium supplements before 50 years. Even after 50 years, if somebody has to take a calcium tablets, they have to do what we call bone mineral density. It's a bone density. We need to check the bone density. If the bones are weak only, we ask them to take supplements. Otherwise, we normally tell not to take calcium supplements. And then certain vitamin D3 supplements. Vitamin D3, yes, in somebody living in a tropical country like this, or people living in Bangalore where sunlight exposure is not enough, they do suffer with vitamin D3 deficiency. Vitamin D3, when it is less than 30 is a normal value, 30 nanograms is a normal value. If somebody is less than 30, is called hypovitaminosis, vitamin D3, hypovitamin D3. So these people can take a course of vitamin D3 capsules or powders, liquids is available. As I said, weekly once they can take for a maximum of 3 months they can take, and then stop it, check the blood levels, and then if required, supplement it.
Alright.
There are some doctors who prescribe injections, vitamin D3 injection. If it is very severe, they can take it. But in my opinion, capsules or oral supplements is enough. And every day, 20 minutes of sunlight exposure is essential for any human being to maintain the vitamin D3. Vitamin D3 is synthesized from the skin. If your arms are exposed, face, neck and back is exposed, that's enough. You need not go have a sleeveless dress or go naked to have a vitamin D3, not required. Normal dresses what we wear is enough. 15 to 20 minutes of direct sunlight exposure is enough. If somebody is photosensitive, that is he goes in the sunlight, he has photosensitive, then he can stand in the shade as well.
Correct. Yeah.
Stand in the shade, that is an indirect sunlight. Even that is enough to synthesize the vitamin D3 from your skin. And once the vitamin D3 is synthesized, it will be there in the blood for 24 to 36 hours only. After that, it disappears. That's the reason we say every day you need to have sunlight exposure.
Correct.
What does vitamin D3 do in your body? Basically, when you take calcium tablets or calcium which comes in your diet, vitamin D3 helps to absorb from the intestines. It absorbs in the intestine and pushes the calcium into the bone.
Correct.
That is a function of vitamin D3. If your vitamin D3 is deficient, then whatever calcium you take, it is not absorbed from the intestine and pushed into it goes as a waste.
Correct.
So vitamin D3 supplement is very essential, along with calcium, and vitamin C is also essential.
Correct, sir. Thank you. And another person, Sushma, she's asking like what different kinds of knee surgery usually people get into or they need.
So based on the, knee surgery per se is a huge spectrum you're asking. So we do lots of knee surgeries, starting from youngsters who are suffering from ligament injury because of the sports injury. What we do what we call is arthroscopy procedure. We put a video camera inside, and if any ligament is injured, we try to reconstruct or repair it. Sometimes the cushion in the knee joint, what we call it's called meniscus. In case if that is torn, most of the time we try to repair it, what is called meniscal repair. If it is non-repairable, then we remove it. It's called meniscectomy. These are common surgeries done for youngsters. But people suffering with severe osteoarthritis is a different thing. There we try to replace the joint because the joint is not salvageable. Again, now you have varieties of knee replacements. You can have partial knee replacement, you can have total knee replacement. Again, in total knee replacement, you want computer-assisted surgery, you want robotic surgery. There are many things. It's a huge spectrum of surgeries. Based on the patient's symptoms, age, requirement, type of injury what they have, and after the surgery what is their demands in their life and expected life, we decide what has to be done.
Correct. Depending on the tear or whatever the etiology they have been into.
Knee replacement normally is done after 55 to 60 years.
Yes.
Anybody below 50 years, we try to preserve the natural joint and try to do any procedure which can preserve your natural joint and get back to your normal life.
Yeah. Thank you. And the next person is asking, are there any risks related in the procedures what they're actually taking care of, like a knee replacement surgery or different kinds of surgery? What kind of risk we can see?
The risk for knee replacements are much less compared to any other major surgeries what you undergo for heart, lung, abdomen surgeries, because when you are operating on a chest or abdomen cavity, you are touching your general system, what we call. But knee surgery is away from your heart and your general respiratory system, so usually the complications are less. It's not that complications are zero, but complications do happen in knee replacement also. As I said, infection is the most common complication which can happen. But if they have chosen a good hospital where the infection control is very good, the hospital hygiene is very good, the surgical team is good, anesthetic team is good, where the surgery is very quick. So the infection rates are much low in a very big hospitals. It is less than 1% what I can say. Then something else you asked.
Yeah, like for
complications. Complications. So one is infection. Second thing, any person undergoing knee surgery after 60 years, 1 to 2% chances there. Post-operatively, they may have fluctuation in the blood pressure, electrolyte fluctuation. That is because of the age. They have disorientation 1 or 2 days, and these are general things which we can handle in the hospital. And normally at 48 to 72 hours, most of the patients who have come out of the surgery have come through all these problems, like vomiting also is a small problem for the patient. Yes, these all things will settle down. At the end of 5 days, patient is completely normal.
Correct, sir.
Then third most important thing is a deep vein thrombosis. When we do surgery, there is a clot in your lower limbs. Very common this is. What we do in a big hospital when the patient is not walked for some time because of arthritis, very high chance that the deep vein thrombosis or blood clotting which has happened in the veins could have happened before the surgery.
Correct, varicose vein.
Yes, varicose veins or deep vein thrombosis. What we normally do is before we venture into surgery, do a Doppler scan, check whether the patient is already suffering with deep vein thrombosis, then we take a precautions.
Correct, sir.
And every patient after surgery, in case if they are normal before, after the surgery, after 48 to 72 hours, we do a scan to check whether the deep vein thrombosis is established or not. It can happen from the time of surgery up to 6 weeks, anytime after the surgery. Now, initially after the surgery, we do a check and we give adequate medication, that is prophylaxis in terms like injections. It can be low molecular weight apparent. When they go home, we may give like aspirin or clopidogrel or many other medication, dabigatran. There are so many things are there. We give that also. With that, in case if what we call is risk stratification, patient falls in the low risk, moderate risk, high risk. Most of the knee replacement fall in a high risk group where there is high chance of having DVT.
Correct.
So we give prophylaxis, medico-legally and medically. We need to give prophylaxis for the patient for 6 weeks. When the patient comes back for first follow-up and second follow-up, we check their limbs. If there is any evidence of DVT, again do a scan, and in case required, we treat it with injections.
Correct, sir.
These are the three most common things. One is post-operative electrolyte imbalance, hypotension, age-related issues, what patients suffer, infection, and third one is deep vein thrombosis.
Okay.
Apart from this, you can have very low percent of small complication, which I don't think we should be enumerating everything.
Correct, sir. Yeah, people should come forward for that. Yes, sir. And now let's go to comment section, and we will see like there are a few comment questions as well, and these are like remedies they're asking actually. How can they get rid of knee pain at home?
As I said, knee pain at home, weight reduction, Regular exercise. If somebody has already developed knee pain, is suffering with knee arthritis, these patients should avoid sitting on floor.
Okay.
Sitting cross-legged is not good for patients suffering with knee pain.
Knee pains.
Somebody has developed already osteoarthritis and never done a yoga before, yoga exercise, he cannot start yoga. Very clear, any asanas where the knee is bent beyond 120 degrees and knee pain is going to increase.
Correct, sir.
If somebody is doing yogasana before, from their childhood or from the early age, and develop arthritis, still they can continue, no problem. But somebody who has never been doing any yoga asanas, develops a knee pain and then starts yogasana, it's not good for them. That is not good.
Okay.
And then regular exercise, as I said, every day 15 minutes of exercise, at least 2 to 3 hours in a week exercise will keep the knee very healthy.
Healthy, yes.
Yes.
Next question is, how do I know if my knee pain is serious?
See, the day when the patient is not able to do his daily activities, and he suffers knee pain in the night times, that is called rest pain. If somebody is not able to sleep because of the knee pain, that means it is very critical. He has to meet a doctor.
Immediate
Yes.
consultation.
Anything when he sleeps, if the knee pain disappears, that means it is because of the stress. He need not even meet any doctor.
Okay. Next question is walking good for knee pain?
Walking is absolutely essential and is very good for knee pain. People think that the more they walk, the knee wears off. Not like that. The more they walk, knee gets nutrition and it becomes more healthier. The only thing what patients suffering with knee pain is to avoid is bending the knee beyond 130 degrees, as already mentioned.
Yes.
Not to sit on the floor, sitting cross-legged. Climbing stairs, getting down stairs is not an exercise for the knee.
Correct.
People think climbing 9 floors is an exercise. No, it's not an exercise. Climbing 2 to 3 floors is good. If you are habituated, if you are having a practice of climbing stairs is good. Or else as a practice to start climbing 7-8 floors is not at all good.
Not recommended.
Yes, and moving away from an Indian style toilet to a Western commode is always very helpful for the patients having knee pain.
Okay.
And patients suffering with knee pain should always sit on a furniture which is higher height, height wise. They should not sit on a furniture which is very low.
Okay.
For them, it is sitting and getting up is painful. Keeping a furniture like it can be sofa, divan, cot, keeping at a higher surface always reduces the knee pain.
All right, sir. And the next question is, at what age does arthritis might start?
May start.
Yeah.
Normally, osteoarthritis starts at the age of 50 to 55. If the patient is suffering with diabetes and hypothyroid, they can start maybe 4 to 5 years earlier. This is a common age. But osteoarthritis is sometimes genetic. There are people who are suffering with at 40 years also, because their parents, somebody, mother or grandmother, somebody suffering with severe arthritis, these patients can inherit that osteoarthritis. Or patients have had a previous injury to the knee, it can be fracture, it can be ligament injuries which are not treated properly, can develop osteoarthritic pain. That is early age, any age.
Any age, yeah.
And another thing is inflammatory arthritis. Patients suffering with rheumatoid arthritis or any kind of inflammatory arthritis, they can have in second or third decades, or between the age of 20 to 40, anytime they can start. But classically, rheumatoid arthritis is 55 to 60 years plus.
Fine. Okay. And these are the questions our viewers have asked, and I'm sure sir has given the best answers he could. And we're going to conclude this session now. And thank you very much, sir.
Thank you very much.
Very helpful, and I guess you will also. And the other thing is, if you have any kinds of doubts or any kind of queries you need to be done, please ask your questions in the comment section, and the experts will definitely answer that. Thank you very much.
Thank you very much.
Thank you.